Okay, so this one's the hip thrust. Basically, before we start off, you've got a couple of adjustments. Okay, the foot plate normally is left at the bottom. Underneath the foot plate, we've got a little pin here, which you can pull out. Okay, and this one adjusts up or back down. Not many people use it up at the very top range. Okay, but from there, you can either go on to step 1 or step 2. So depending on ankle mobility, okay, it depends on how much range of movement you can get. Okay, and the way you test that is when someone's sat on there, if you raise it up, okay, and basically their toes are coming off because they can't get a flat foot, the plate's too high, so you just lower that one back down or raise it up if you feel you can go a little bit more. Okay, next one is basically your seat position will adjust from here. So you pull up the little lever, okay, and then that one will push backwards or forwards from there. So depending on where your start position is, depends on where you get from there. So Millie, if you want to come and take a seat. So the seat position, when you place your feet up onto the plane, I know Millie's ankle mobility is good, so the foot is flat when we're raised up here. If it wasn't, and again the toes were angled like this because the ankle's restricted, we just lower this plate down using that little lever again. Okay, what we want to do is start off with about a 90-degree bend in the knee. So all we need to do is adjust that one, bring that forwards a bit more. Perfect, so we're roughly around in that 90 degrees. Okay, before you add on any weight, okay, and you put the seat belt on over, which just plugs in to the bottom end there, okay, just a normal bus or aeroplane seat belt. Basically what we want to do is make sure we've got technique before you start adding any weight on from there. Next to us, there is always the band as well, so you can put that through and again, it can wrap over the knees, so you can drive out to get a bit more glute activation. So that one's just usually kept on top there. So what we're going to do is first of all tuck the arms across. Perfect, again from here we're going to move, not necessarily the hips straight up, but we're going to drive the knees across, okay? But before we do that, what we're going to do is tuck the hips so our abdominals are contracted. So again, really thrust through, get the abdominals contracted as much as we can, okay? So we've got no movement in your lower back at all, okay? Then from here, you're going to keep on looking forward, so we're not swinging the head up and down. Okay, we're going to stay nice and tight. Okay, slowly start to push your knees up towards my hand, keeping that lower back tucked. Okay, perfect from there. So again, when you go through, if you're trying to raise up, you'll get it all across your lower back. So what we're looking to do is to use those glutes. Okay, nice and tightly tucked in. If the knees wants to collapse in, okay, basically what you want to do is just drive those knees out a little bit so you get more glute activation. Gently come back down, okay, and what you do is only come down as far until the weights just about touch. If you're Rob and you've got a massive ass, or it's just a massive ass, basically your bum will touch the seat before the weights will. Okay, it's not very common, okay, but basically most people, their weights will touch before their bum. So basically it's the point that we want to keep contraction all the time. So as we go up and down, if you go again, release, you get into position, you tuck through, excellent, again, these knees are driving forwards. Perfect, they're not going past the toes. The hips will never come up here because it's not a bridge, it's a hip thrust. Perfect, good, come back down to the seat. Good, perfect, stop from there. Good, gently come off.